When dealing with cancer, there are several tools to diagnose and treat cancer. Dr. Shannon Cox is a radiation oncologist, and he's here today to tell us about the precision of the CyberKnife robotic system that can treat many different forms of cancer, including brain cancer. Hi, Dr. Cox. Thanks so much for being here.
Yes, glad to.
Why don't we just get into, what exactly are brain tumors?
Well, there are basically two big categories of brain tumors. There's benign and malignant. Benign tumors sometimes can be there for many years before somebody even realizes they have them. Malignant are divided into primary brain tumors that start in the brain, like Dr. McCain and Ted Kennedy had. And then there's the metastatic. So the malignant are divided into the primary in the brain and then those that spread to the brain, which are metastatic.
So what is metastatic cancer?
And basically, a good percentage of tumors in the brain didn't start there. They came from the lung, they came from the breast, they came from breast cancer, lung cancer, or some other type of cancer. And they spread hematogenously or through the bloodstream to the brain. So.
What are symptoms of metastatic brain tumors that you've seen with all your patients?
And really, they can be anything that the brain controls, from vision, hearing, speech, coordination. Any of those could be sign of potentially of a tumor. Those could also be sign of a stroke or other things, but the tumor can go anywhere so anything that the brain controls, which is literally probably the most common are vision, speech, or having a headache. Headache can be a very early sign of it. Yeah.
So how do most people kind of self-diagnose that something is wrong? Like at what point do they actually realize, hey, I need to go see a radiation oncologist?
Usually this one, it's not very subtle. They wake up or they one day cannot see out of one eye, or they have trouble hearing, or maybe have a pretty intense headache that's new.
So where do you come in? How does Austin CyberKnife treat brain tumors?
Well, one of the advantages, of course, the weapons you have against any brain tumor, whether benign or malignant, are surgery or radiation. And the nice thing about CyberKnife, it's very, very precise. We work real well with our neurosurgeons, but there's some that, depending on the patient's age, depending on the location, are better for surgery, and some are better for or radiation. But CyberKnife is amazing. It's really pretty revolutionary in that its ability to just pinpoint that area and spare. Because when you're in the brain, there's not a lot of room for error. You've got to be very
precise.
Very precise.
Yeah.
We might be treating something right adjacent to something critical, like the optic nerve or the brainstem, and so it's a very, very precise, almost laser-like technology that continues to amaze me. It really does on a lot of our patients.
So what are the benefits of using CyberKnife?
Yeah, main benefits is avoiding surgery, because one thing about the brain, there's the skull, which is, you have to get through that surgically, and that's not easy no matter how you do it. And so a lot of times we can avoid doing what we call a craniotomy or brain surgery, which carries a lot of inherent risk in it. So, and you don't have to do any surgery with CyberKnife. I don't really like the term knife. It's not a knife. It's more a radiation type tool.
How long have you been a radiation oncologist for?
I've been 30 years.
Wow, that's a really long time.
Started when I was 10.
Well, thank you so much.
Yes.
You are doing such good work in the community. We really, really appreciate having you here.
Thank you very much.
Thank you so much. Austin CyberKnife is located on I-35 near the Del Seaton Medical Center at the University of Texas. Call them at 512-324-8060 or go to austincyberknife.com.